Hey guys, what's going on? This is Tyler, pharmacist with Pharmacy Update, and today I'm going to discuss a very popular drug normally used to treat heartburn, and that is Omeprazole, brand name Prilosec. I'm going to cover the uses for Omeprazole, how to take this medication, the possible side effects of Omeprazole, and then at the end of the video I'm going to discuss some possible long-term effects that Omeprazole can have. So if you or someone you know takes this drug, this might be information you want to hear. So here we go. First, I want to cover the uses of Omeprazole. Probably the most common use is gastroesophageal reflux disease, or GERD. And that's basically just a fancy way of saying heartburn. So if you're getting heartburn more than 2 or 3 times a week, you may possibly have GERD. And this is most commonly described as a burning sensation in the center of the chest that sometimes will extend to your throat. And this can make people very uncomfortable. It's not a fun thing to have. It's estimated that GERD affects over 10 million people in the US alone, and that's on a daily basis. So it's a very common problem to have. And Omeprazole does do a nice job of preventing this when it's taken. Some other things it can treat is H. pylori. This is an infection in the stomach due to an overgrowth of this bacteria. This causes an overproduction of acid, causing heartburn and possibly some other symptoms. And Omeprazole, along with antibiotics, can be used to treat this infection. It can also be used to treat stomach ulcers as well. So what is the best way to take this drug? Well, first of all, you will want to take this at the lowest effective dose and also for the smallest amount of time possible. And when I get into the long-term side effects, you may realize why. The recommendation for mild GERD symptoms is to take Omeprazole for 8 weeks and then taper yourself off the medication. If you still have GERD symptoms after that, it's really up to your doctor on how to proceed. You really don't want to stop this medication immediately because you can have some rebound acid reflux. So you will want to slowly decrease your dose over 2 to 4 weeks. And at the end, you can start taking it every other day instead of daily. And doing that will help relieve some of the rebound acid reflux. They recommend that you take this medication 30 to 60 minutes before breakfast to get the full effect, or really just 30 to 60 minutes before any meal. And once you start taking Omeprazole, you will want to make sure and try to take it at the same time each day to get consistent acid suppression. You will not want to crush or chew the capsule when taking this. However, you can open up the capsule and mix the contents with a tablespoon of applesauce, if that would make it easier to take. Just do not chew on the applesauce. Also, if you do this, make sure you take the medication immediately. Don't pre-mix it for later. And finally, this is not a medication that will work immediately. It does take some time for it to kick in. If you are in need of immediate relief, you'll likely want to get an antacid such as Tums. Now, it does start working the first day you take it, but you really won't get the full effect until 1 to 4 days later. And like I said, after those 1 to 4 days, it does usually work quite well. Now I want to move on to side effects of Omeprazole. And I want to start out by saying that the grand majority of people who take Omeprazole really don't have any issues, especially if you just take it for a short period of time. It really is well tolerated. And that's one of the reasons why it's such a popular drug, but there are some side effects you may have. I certainly didn't list all the possible side effects here, just some ones that I picked out. Probably the most common side effect is headache, with around 7% of people getting this. You could also have some abdominal pain, diarrhea, nausea, and vomiting. And dizziness is also a more common side effect. Some rare and more serious side effects, these include liver problems, a rash that can sometimes be very serious, and also C. diff infection. Now, this is an infection in your gastrointestinal tract that causes you to have severe diarrhea. And it's very hard to get rid of, and it is contagious. And I'll get into this a little bit more when I cover long-term side effects here shortly. Alright, now my last topic is possible long-term side effects of Omeprazole use. And this is the reason why you'll want to take the lowest effective dose for the shortest period of time. And this really goes for all PPI medications. That is the class of medications that omeprazole is in. Now, some of these are controversial. The jury is still kind of out on them. They will have one study that shows a link and then another study that will show no association. But they are something you'll want to be aware of. So here we go. First one here is low magnesium levels. So PPIs can possibly cause you to absorb less magnesium. So if you are planning on using this for an extended period of time, you will want to get your magnesium level checked periodically. And some possible signs that your magnesium levels are low include muscle twitches or cramps, fatigue, and also just some general mental issues. It is also possible that PPIs can lower your B12 levels, so watch out for that. Similar to magnesium, if you're going to take this drug for a while, you will want to get your lab checked every now and then. And like I mentioned before, PPIs can cause an increased risk of C. diff infection. And this is something that is also associated with antibiotic use, these C. diff infections. But they have found that just taking a PPI alone without antibiotics can increase your risk. And this is a very serious infection. If you start having bad diarrhea while taking this medication, you will want to consult your doctor. Next one here is an increased risk of fractures. So PPIs can cause a decrease in intestinal absorption of calcium, especially non-water soluble calcium such as calcium carbonate. And the FDA does advise patients that taking omeprazole or other PPIs can increase your risk of hip, waist, and spine fractures. So just keep that in the back of your mind. Moving on, it can possibly decrease your absorption of iron. However, the clinical significance of this is questionable. If you do have low iron levels and you take this medication, you may possibly want to try something else. Kidney issues. So there are some studies that have shown that the use of PPIs can increase your risk of chronic kidney disease. So watch out for that. Dementia, this one is very controversial. Some studies have shown a link between PPI use and dementia. Then there are other studies that show no link at all. So this one is still up in the air, but still something you'll want to be aware of. And finally, there has also been some studies showing an increased risk of getting pneumonia when taking PPIs. So like I said before, the jury is still out on many of these, but you do need to be aware of them and really try to take the lowest dose possible. Well, that's all I have for today, guys. Thank you for watching. Please subscribe to my channel for the latest pharmacy and medical updates, as well as drug overviews such as this one. Remember to always follow the instructions of your doctor. This video is just for informational purposes only and shouldn't be taken as medical advice. If you do have questions or concerns, please comment below, or you can speak with your doctor or pharmacist. So thank you guys again, and have a nice day.